Hello, welcome to MedLife Scoop powered by MediPocket. Today, we will be talking about the healthcare system of Africa. And here, as our guests, we have two personalities as leaders in their own fields and are from Africa with the ground reality of a healthcare system there. In many countries in Africa, the system is very different, but with the common problems. And today we have our guests, Mr. Jerome and Becky, to address those questions, give us the insights and some solutions that we are working together. Welcome, Jerome and Becky, to MedLife Scoops.
Thank you for having us.
So to jump right in, can you briefly introduce Jerome yourself and UMG, your organization, and tell us about your journey?
My name is Jerome Sheldon, and I'm the CEO of Umbrella Management Group. I'm also an international partner with WBAF, and that's the World Business Angel Investment Forum. Now, my journey started when I visited Liberia, which I'm originally from, and of course, I'm residing now currently in the United States. So I've been away from home for a long time. But my journey back to Liberia really brought some few things back to me, helping to kind of understand some of the conditions that are going on, in Liberia, in terms of healthcare, in terms of financial stability and things of that nature. And so it really moved me then to start Umbrella Management Group, which is a company that actually builds strategic partnership with companies both in Liberia and also outside of Liberia to bridge that gap, about, I would say capacity building. So what is lacking is where we try to bridge that to help both sides of the equation, those, companies on the global side and also businesses that are in Liberia too. But in so doing, to be able to address some of the issues that are in Liberia. So that's how my journey started. And then eventually I kind of scaled up to Africa as a continent.
Amazing. And then, the bridging the gap has always been our purpose. And similarly, with UMG, you have bridging the gaps when it comes to various sectors, various needs in Africa, and the companies who want to go in Africa.
Right.
We know that you are a part of such a big organization that is keen on helping the people of Africa. Now, as a leader with a strong background in business and philanthropy, how do you view the intersection of healthcare and entrepreneurship, especially in Africa?
That's a good question. Well, I see the intersection, I would say, of healthcare and entrepreneurship in Africa. I see it as a huge opportunity to drive both social impact and also economic growth. You see, entrepreneur brings innovation, agility, and also scalable solution to address the healthcare challenges. For example, like access to affordability. Now, by partnering with local insurance companies and corporations, and of course, government entity, organizations like Umbrella Management Group, and of course, MediPocket can bridge the gap between the global, expertise and local needs.
That's amazing. And absolutely right, as you said, creating that environment is essential where you can nurture such innovations, ideas, interconnections. So I would like to now bring Becky into our conversation. So happy to have you at MedLife Scoop podcast. And Becky, can you briefly introduce yourself profession-wise and your purpose-wise in Africa?
Well, my name is Rebecca, but everybody calls me Becky. I'm a broadcast journalist with one of the biggest media houses here in Ghana. It's called the Multimedia Group. And I'm also a country manager for UMG when it comes to propagating the news of MediPocket. So yeah, I'm happy to be here on and good thing that you're doing with getting the message out there about healthcare and everything MediPocket. Kudos to you. Yeah, grateful to be part of this.
Yeah, and we are very happy to have you because I know with your contribution and your efforts in Africa that you're doing for UMG and MediPocket, we will be able to bring the change, the purpose that we all have in heart. That every country has its own pros and cons when it comes to the healthcare system. Could you give us an overview of current healthcare situation in Africa and what are some of the most pressing challenges you have observed in recent years?
Well, locally here in Africa, I can speak for the entire Africa. We all know that there's limited facilities and specialists when it comes to healthcare in Africa. Personally, here in Ghana, I know that we have all the facilities that we have, but it cannot match up to the international standards, which is why you see or you get people who can afford healthcare elsewhere try traveling around to get the needed healthcare that they have. I know that, and we've had a lot of people coming from outside, sometimes America, to extend supporting hands to these facilities here in the country, but obviously it's not enough. So the challenges is endless. You can't say that you can't pinpoint exactly, but we have challenges, not just like the Americas or the India, where you have quality healthcare, because you have people traveling from here to those countries for proper healthcare. So the challenges are many, and
so what would you say the challenge is? Mainly because, as you said there are many. Now, if you have to put them into a particular bucket, do you think it's mainly because of lack of infrastructure, the lack of access, or the lack of availability of when it comes to specialty care or specialized care?
Lack of infrastructure is one of those, and also lack of specialists. We have most of the specialists traveling. We have some specialists here, but because of obviously monetary issues, they travel around the world. They would rather practice elsewhere, not in Africa. So we don't have the structure, the facilities available. There's limited facilities here in Africa and limited specialists in Africa. So it becomes really difficult to assess all these people, the facilities and the specialists as well. So that brings me to the point where we all have to struggle and travel out of the country, because all these people have traveled out of the country to get proper payment for the specialists, or for proper medical treatment for the patient. Yeah,
that's quite relatable in a lot of countries. When it comes to Asian countries, also some of the European countries, where a good specialist comes out of the country for the better, better sustainability for himself and his family, compensation wise, I would say. and they look for better environment where their skills can be developed better and compensated better. And that is absolutely one of the big challenge, I would say, keeping these specialists in the country where they also feel empowered from the latest advancement. I believe they, as a physician myself, and a global healthcare person, as a healthcare provider, you always want to be updated. What's new in the world, or and can be able to learn and use such advancements for your patient benefit. But sometimes what happens if you're in particular region or particular country, you get restricted to access to those kind of advancements to learn about it. And that is, I think, is a very big challenge that even at MediPocket, we looked into it, how we can bridge this gap of access to, the new, the knowledge, advanced knowledge, let's say. And that in medical terms happens with peer-to-peer consultation, peer-to-peer review, or we also call it CME, which is continuing medical education, where the experts from one country can do the medical education to the experts in the other country, or the young doctors, the young specialists can learn from these specialists that are very with the years of experience in the country that has those capacity, capabilities, and advancements available. So it's good to know that we are working in the right direction with the problems that you just mentioned. To just further on that one, I mean, as you said, Africa is diverse in its healthcare needs across different regions. How do you see the healthcare infrastructure vary between countries, and what specific areas need urgent attention?
The specific areas I think for general medication, or I don't know the medical term for it, but for general services, I think that, for Africa, we have, enough hospitals to deal with that, but the specialist, the part where, for instance, somebody they had to get a kidney transplant, or somebody had to go through chemotherapy. So basically, the specialist or somebody needs to go and go under surgery, do something just to get the specialist facilities, and the specialist is very key, if you ask me. And
And do you feel like different regions, like different countries in Africa, some are a little bit better in that? And so patients from one particular region, one particular country in Africa can travel locally because it's not completely coming out of Africa. But let's say, do you see that some regions are a little bit more empowered, a little bit better when it comes to specialty care than the other regions?
yes, absolutely, I believe so. For instance, when you go to the French-speaking countries, for instance, Togo is very close to Ghana. They have some very good specialties, special hospitals or specialty hospitals there that people travel to assess. I recall one of my friends had to travel all the way to Togo for a certain operation or certain surgery to be done. So yeah, some African countries, yes, they do have or have been empowered with all these specialty hospitals that we can travel to and from to get healthcare. But that to say is not enough. Yeah.
So though there is a possibility, but they still have to travel outside the country. Even that
Yeah.
is limited based on the ratio of what the need is to what the demand is and what the supply is. Still a big gap, I believe.